Selective Mutism, The Sound of Silence. Informational PowerPoint by Allie Miskinnis. Have you ever wondered what it would be like to not be able to speak? To hear all of your classmates shouting and laughing and making jokes, and you desperately want to join in, though each time you try, fear and anxiety paralyzes you. So you close your mouth and sit alone on the opposite side of the classroom. You're the one they call weird, the silent one, the one no one wants to be friends with. You know this is only because they don't understand you. You can't blame them because you don't understand either. Why is it so difficult for you to speak at school, in the store, in public in general? Why is it everyone else finds speaking so easy, but it's so difficult for you? The answer can be summed up in 2 words: selective mutism. The first question you may ask is, what exactly is selective mutism? The first thing I can tell you is that it's more than just shyness. What's the definition? The most accurate definition is consistent failure to speak in certain social situations. This could be anything from a simple family gathering to school to big social gatherings like the state fair, concerts, or rallies. It used to be known as elective mutism, and it was falsely believed that the children were doing it deliberately. When it was discovered that it wasn't a choice, that they literally couldn't speak, it was changed to selective mutism. It's a major social anxiety disorder where the selectively mute person has an acute anxiety of the expectation to speak. It often starts when the child is very, very young. They go through a traumatic event or just find the thought of someone outside their immediate family hearing their voice rather frightening. Also, more often than not, they come from a family with a history of anxiety. It is a common misconception that the child is just doing it deliberately, just pushing it on and on. The thing is, though, they couldn't do it for so long if it was a choice. There are children with selective mutism who have broken limbs and they haven't cried. They may shed a tear or two, but there's no cry for help, no other indication that they're in pain, aside from the silent tears. Why am I just hearing about it now? The truth is, it's a more popular disorder than autism. Most people just don't know it exists. They dismiss it as shyness or believe the child is just stubborn and try to force their child to talk. This, of course, frightens them more and later find it more difficult to shake the fear. About 1 in every 150 children and a few adults struggle with this anxiety. Is there treatment for selective mutism? Because we still aren't sure what causes it, treatment is difficult to find. There is professional treatment out there, however, and there are success stories all over with children beating SM. Dr. Elisa Chapon-Blum says, when the emphasis is on trying to get a child to speak, you're actually reinforcing the anxiety. So these children just hear the word talk and their anxiety level goes up, because everyone around them is focusing on getting them to talk. So instead, they try a technique called ritual sound approach. It teaches the children to make sounds before saying the whole word, like S for yes and N for no. They also can try something called the sliding in approach, where someone that the child is comfortable talking with sits with them in a comfortable environment. They play games that involve verbal communication. First, with one adult, they don't normally talk to outside the room with the door shut, then open, then with them in the room. If the parents and children are desperate enough to get over their SM, some turn to medications. A popular one is a daily dose of Prozac. Though we are aware that Prozac isn't normally prescribed to children, it does lower their anxiety enough to assist the child in getting over this condition. Basically, what I said on this slide is that you need to be patient and encourage the child to communicate in whatever way they can. And when the child does speak, don't make a big deal about it. Just act as though it's normal for them to do. Don't reward them, but don't force them to speak, because that actually can make them worse. One more thing, just remember, the more you know about selective mutism, the better chance we have at breaking the silence. Thank you.